Gentleman over here with low back pain, and to start off with the Gonstead method, we start off with history. And this fella 6 months ago, he fell off a forklift, injured his back. Next component is visualization. So we take a look on his back over here, and as you can see, he's leaning all the way towards the left. So I don't focus on where it's most grossly exaggerated. No, I want to take a look where did it really started from. So he's still leaning towards the left, all the way straight and down until this region over here. Next component, right, we're seeing the swelling over here as well. So in this area over here, I'm going to take a closer look. We're feeling for, is there any swelling? So even though this is about 6 to 7 months old, the swelling starts to become chronic and start to decrease a bit, but it's still present. So because I want to feel it nice and smooth over here, but it's boggy over here, right? So next component, let's test it. How's this feel over here? Pain, right? That's that fifth lumbar right over there. And when we check on this one, how's that feel over there? Pain. What about here? Pain. So we're going to check what's moving, what's not moving. And we see that his hips are moving quite fine on the left side and the right side. When we check the fifth lumbar itself, this fellow over here, see, it's not moving whatsoever. His body is guarding. He's wincing in pain. All the muscles on the left side is very tight over here and not as tight on the right side. Let's go ahead and take a look at the films. When I take a look at your x-rays and combining all the data we have accumulated so far, in the Gonstead work, we're looking for, is there any structural abnormalities? And we found a big one on you. What we see is this fifth lumbar over here went way backwards, rotated towards the right, and the wedge on the right side. What we call this PRS. So to clarify, I want to see this fella in proper alignment. However, in your case, the first listing, P, stands for it went posterior. It went backwards. Next component, this spinous listing over here, it turned to the right, as such. And the final listing component is the S. So it went wedging on the right side. So on you, what happened was that bone went backwards, it went this way, and wedged that way. So it duplicates your whole entire position, what you're doing right now. Is you're basically twisting your body this way and leaning away from it. That's the fellow where it all started. And that's what we need to reposition. That fifth lumbar, we're going to contact, because that's been in a subacute state over there. Instead of a usual spinous push or spinous finger push, we're going to do a nice good old laminar transverse contact, and we're going to really close that wedge and get that significant tilting you got going on, get you a lot more upright.
Move more.
You can move more?
Yeah.
Okay. What about the pain in your low back? How's that?
Not as bad.
Not as bad?
Not
Okay.
as bad.
Alright, to clarify, how much would you say is different from before and now?
It's looser. I feel not as stiff.
Mm-hmm. So just take a look at visualization over here. As you can see, because we corrected that fifth lumbar, and there's still some swelling over there, there is still some residual wedging over here. That's why he has a tendency to try to lean still a little bit to the left side. As you can see, overall, it's significantly different from before. Right? So, your homework is this, champ. Right? I want you to ice this fellow over here, because we still got to get that swelling out of the way. You'll calm that disc down, and you'll notice your overall spine structure will be more upright and in the more normal position as well. Okay, so as we see over here, it's been 3 days. Overall, the structure itself looks a lot better. We still see some listing going on this side over here. So, fill us in. How are things since I last saw you?
Much better. I don't have to lean on one side as much.
Mm-hmm.
I can walk better than I used to, instead of limping all the time, and that's pretty much it. I feel good.